In this video, I'm going to show you 3 techniques, manual techniques you can use to treat someone with lateral epicondylitis. They usually have pain on the lateral elbow. It's tender with palpation of the common extensor tendon, the tendon that runs to the finger extensors and wrist extensors and the supinator. So they have a common tendon right here. So 3 techniques that we're going to use. First one is going to address the antagonist of this muscle that is long and weak. So the trigger point or the short tight muscle tends to be on the flexor side. You can palpate that trigger point usually just inferior to the common flexor tendon and throughout the wrist flexor muscle belly here. So we're here in this muscle bulk area. We are palpating pronator teres, flexor digitorum, and flexor carpi radialis. And so they run in this diagonal pattern. So just doing longitudinal massaging. If it needs to be done, the patient will feel a trigger point, usually in the middle of the muscle belly. All right, again, this video is how to treat with manual therapy lateral epicondylitis. And so if you didn't catch it the first time, I am massaging or loosening up the trigger points, the short, tight antagonists of the wrist and finger extensors. Okay, so the first technique is this longitudinal massage of the wrist and finger flexor muscle bulk. You can also use instrument-assisted soft tissue mobilization. Cupping is also beneficial in this area to help decrease tension here and take the stretch off here, okay? The next technique we're gonna do is a transverse friction massage to the common extensor tendon. So have the patient place their hand here with their hand in, we call it hand in pocket kind of orientation. This is the open packed position of the radial head. And it's a nice way to be able to identify the common extensor tendon. So find the lateral epicondyle, big bump here on the lateral elbow, move inferior off of it, and you are now on the common extensor tendon. The tendon runs in this direction, and so you are going to do transverse friction massage. And we typically like to have the muscles in a slightly extended, stretched out position. So you're going to put the elbow in extension with the wrist in a little bit of flexion, and then you can do this transverse friction massage. I like to use the finger over finger technique over that tendon. It will be tender where you do this massage, and then as you use moderate pressure and then consistent rhythm, inside of a minute, this should go numb or the pain should be significantly less. And that is how you know you have correctly applied transverse friction massage. Now, transverse friction massage simply increases blood flow to a tendon. Tendons don't have really great blood supply, and so this helps increase the blood flow to the tendon and helps the healing take place faster. Another technique I want to show you is the radial head mobilization. Many times with lateral epicondylitis, the radial head is in a slightly subluxed position. The most common subluxation is a slightly anterior position, and it's usually because of a trigger point in the bicep brachii muscle. But first, we can do 2 things where that's concerned. First one we're going to do is a posterior mobilization of the radial head. So with the hand in the hand in pocket position, stabilize the distal humerus, and then take your thumb and index finger and wrap it around the radial head, and then you are going to do a posterior glide. The direction of my glide is this way. All right, so from neutral, a grade 3 or a grade 4 posterior radial glide. I do 6 to 10 repetitions, and then I retest either resisted wrist extension or finger extension, whichever one brought on the pain. If that mobilization doesn't quite do the trick, they may have an underlying significant trigger point here in the biceps brachii muscle belly, and so it's helpful to do longitudinal massage to the biceps brachii. They typically will have a tender point here as well. And so I just do longitudinal stroking, just like we did on the flexor side of the forearm, using moderate pressure and consistent rhythm. That is the key to getting this trigger point to relax. If you push harder and harder and harder, the body never gets to accommodate this noxious stimuli, and so it doesn't ever get to relax. So if you want the trigger point to relax, it's consistent pressure and consistent rhythm. Okay, so those were 4 techniques. Soft tissue mobilization to the wrist flexors to help these long, weak extensors. Transverse friction massage to the common extensor tendon with the muscles placed in a slight stretch. A posterior radial head mobilization. And then finally, soft tissue mobilization to the biceps brachii. Try these 4 techniques with your lateral epicondylitis patients, and you just may find you've given them some pain relief.